I'm Dr. Lee Schwamm, the Chief Digital Health Officer at the Yale New Haven Health System and Yale School of Medicine, and I'm here with my colleague.
Hi, I'm Dr. Sneha Jain. I'm a clinical assistant professor in the Division of Cardiovascular Medicine at Stanford and the director of the Guide AI Lab.
So we're here today to talk about the science advisory that just published on the pragmatic approaches to the evaluation and monitoring of artificial intelligence in healthcare. And we're going to talk to you a little bit now about what you'll find in the advisory. The reason that we were so excited to work on this advisory is that health systems face a really unique challenge in the selection and implementation of AI in healthcare. And much like a new car buyer wants to understand what are they getting before they buy that car, and they look at the car sticker to see all the federal safety standards and miles per gallon, but they still want a Consumer Reports evaluation that tells them how did that car stack up to other cars from an independent agency. And then lastly, they want to make that test drive. How does it perform for me? And over time, does my car still perform the way I expect it to when I bought it? Healthcare systems face similar challenges. And so, Sneha, talk a little bit about what we tried to do in this advisory and what solutions we think the AHA can help to bring to this.
Yeah, sure. So we really tried to talk about three things. The first was, what makes AI different? How is it different from what we're used to in healthcare, evaluating drugs, devices? The second thing we tried to think about was, what's AHA's role in all of this? How can the AHA support hospital systems and the field at large in thinking through the right ways to evaluate and monitor these tools, but doing it in a pragmatic way? Because a lot of healthcare systems are under financial pressures. And given the incredible size and number of AI tools that are out there, we can't have the same evaluation and monitoring approach for each one. We need a risk-tiered approach. And then lastly, we wanted to provide that pragmatic framework for healthcare systems. What questions should they be asking across three phases: pre-deployment, during implementation, and post-deployment during that monitoring phase. And Lee, can you talk a little bit about what you think the AHA's particular value add is for this?
So I think AHA can lead in several domains. The first is that AHA is an organization built on evidence generation. And so helping to set the standards for what kind of evidence should be available for health systems when they look at AI tools, thinking about alternatives to randomized trials, which will evolve way too slowly for most evaluations of AI tools that are evolving faster than the trials are accruing patients. But also being a trusted broker to perhaps participate in what AI assessment should look like. That's why I think it's very exciting that they've partnered with Dandelion to launch an AI assessment lab that will help early stage developers have access to large populations of patient data, diverse patient data, in which to validate those algorithms. So we can get that car sticker before that startup comes to try to enter the market to provide those algorithms to healthcare systems. I think in the future, there are opportunities for health systems to engage with that assessment lab to do that second phase of validation. Maybe it's just that it's reassuring to me that if it works in a diverse population of someone else's patients, it's more likely to work at mine. If I'm an advanced health system, maybe I have the resources to do that silent validation or assessment myself. But I think there are really important opportunities there to set a level playing field.
I love that. And I think the other thing we try to talk about in the advisory is, it's one thing to evaluate the tool and how it performs, but then we also have to think about how it interacts in the workflows in which you deploy it. And so we end up talking about these 4 categories of questions that health systems should be thinking about, kind of guiding principles, if you will. And that's strategic alignment. How well do these tools fit into what the hospital system is trying to do? The second is ethical evaluation, and that one is really critically important at each of the 3 phases. The third is thinking about usefulness and the actual impact that these tools are having, and if they're creating impact over time. And the last one is sustainability, really financial sustainability over time. And I think that that framework is helpful across the 3 phases because you ask different sets of questions at each point, but it gets to the heart of, is this the right AI tool to deploy? What do I need to be considering about? What are some unintended consequences, and how do we mitigate against that?
And all of that is different for St. Mary's than it is for Downtown General Medical Center?
Yes.
Because every hospital will have different strategic objectives. The other thing I think I want to emphasize that I would have said at the beginning is AHA is known for putting the patient in the center. And with these AI tools, there's such a risk that we lose track of who the patient is in the process. And so creating a core set of principles that can be locally customized for whatever it is that the health system needs, I think provides the best kind of framework we can in a field that is evolving so rapidly.
Mm-hmm. And I think what you just said is so important. It's evolving so rapidly, the technology is going to change so quickly, and we need to remain agile in our ability to evaluate and what evaluation methods we have. So you said it already, but I think it's important to emphasize that it's probably not going to be the randomized controlled trial for many of these tools, the right evaluation method. So we need to figure out how we bring together healthcare delivery and the evaluation of these new tools that will be deployed in healthcare delivery. And so it's a really exciting time, I think, for AHA and for our field in general.
And I want to end by thanking the members of the writing group who worked ferociously and in an incredibly dedicated way to bring you this science advisory in time for scientific sessions, to the AHA staff who supported this paper from the very beginning, to all the peer reviewers and SAC and the rest of the organization who contributed so meaningfully. We're really excited, and we hope you'll want to read the advisory and provide feedback. Thanks so much.
Thank you.